Good morning, good afternoon, and good evening, everyone, from wherever you're joining us, and welcome to today's webinar titled Simple Tips to Significantly Improve Rodent Surgical Outcomes, featuring Dr. Marcel Perret-Gentil, University Veterinarian and Director of the Laboratory Animal Resources Center at the University of Texas at San Antonio. Today, he will present 6 simple-to-implement techniques to significantly improve surgical outcomes. I want to take this moment to thank our partners at the Academy for Surgical Research and the sponsor for this event, Kent Scientific, for making it all possible. I am excited to bring Marcel. Good morning. Thanks for being here.
Thank you, Sydney. Thank you for the presentation and thank you for the poll questions. And let's get started. Hi, everyone. I want to thank you for being present for this webinar. And I would like to thank, in particular, Kent Scientific and the Academy of Surgical Research for making this possible. And this presentation is a distillation of a much larger presentation that I give. Is more of a 4-hour presentation. However, I have put together some very simple tips. I'm going to spend some time and more time in some tips than others. But if you implement these tips, I can promise you that your surgical outcomes and your data will significantly improve. And that's what we're all about when it comes to research. But first, let me tell you about Rita before I give you the first tip. So, Rita, she was summoned at this hospital back at the beginning of the pandemic. And she was, at that time, 85 years old, had been out of practice, out of nursing for quite a while. And I look at the mistakes that you can make when you do these things. And of course, this is not a true story, this is all made up. But there is I'm concerned about many investigators that they appoint sometimes their students or someone in the lab to do these surgical procedures with very little practice. So my encouragement to you today is that when you undergo your protocols, your surgical protocols, make sure that in the protocol you provide for enough animals to practice. So you can make all the mistakes and perhaps in your non-survival procedures. So when it comes to your actual studies, your techniques, whether it is you who does and your students or your lab members, have improved their technique to the point that there is minimal tissue damage and better surgical outcomes. So the 6 tips that we're going to be talking about, we'll talk about the importance of acclimation. We'll talk about aseptic technique, temperature regulation, hydration, oxygen supplementation, and non-pharmaceutical methods of pain control. These are all very simple tips, perhaps with the exception of number 2, aseptic technique, which takes a fair amount of practice and really dedication to improve your aseptic technique. For those of you that may need an explanation of asepsis, asepsis means lack of contamination, which is not 100% possible in any surgery, but nonetheless, we use that word is the minimization of contamination in the surgical wound so that the animal's immune system can overcome the infection. So let's talk first about acclimation. So here we have this guy here that has gone through a long trip because when you place your order for your mice, let's say Charles River receives the order, and then the animals are placed. I have lived all their lives in this one cage, this light, these smells, this bedding type, this feed, people in the room, and then all of a sudden you place these animals into a new box. The technician places the animals into this new box. They go through a hallway, hearing new voices, go into a diesel truck, vibrating, smells. They go overnight or however long it takes to get to your facility. Once they get to the facility, then they go through a new hallway. They're unloaded. They go to a new room, and they go into new feed, new lights. Everything is new for these animals. And we know that rodents, most species, really do suffer from what's called neophobia. And so by the time these animals get to your animal facility, wow, these animals are really, really stressed. And we know that stress activates the fight or flight syndrome, which really leads to a secretion of all these hormones, epinephrine, norepinephrine, including some cortisol, glucocorticoids, steroids, and all these this stress and these chemicals and neurochemicals, they sensitize the heart to arrhythmias and leads, in fact, to even delayed wound healing. So acclimation, I'm not going to say much about this, but at least in my institution, we have a period of acclimation that every year I cook is going to have to decide what it should be, but we require a minimum of 3 days, and perhaps it should be longer than that. So please don't go do your surgeries on your animals in general unless these animals have acclimated to the new environment. So this is what we're looking for, so you minimize really mortality, post-op mortality, morbidity as well, but also affect data. So let's jump into aseptic surgery. And uh, I've heard it many times, the investigator that brags, look at how successful my surgeries are because I don't have the animals don't look infected. In fact, or the animals are they live. So they're relying on survival for the success of their procedures. What they don't think about is that and those individuals, they say, okay, all my animals lived, or 98% of my animals have lived. They don't know that because of the lack of aseptic technique, what happened under that skin, the altered physiological function, the immune responses, and behavioral changes that really does affect research. You may not be concerned about these, what we call subclinical infections, and your dog that comes from the vet clinic that was spayed, but in research, we're concerned about these things. So let me convince the audience, whether you are in the United States or you are in Spain, whether you're in South America, and and let me convince you that aseptic technique improves the outcome of your surgeries. I'm not please don't read every sentence, every word that's in here, but I just want to emphasize that there's plenty of data that really indicates that when there's contamination, you activate the immune system, macrophages, cytokines, and etc. And subclinical infections really lead to physiological changes. So let's differentiate between clinical and subclinical infections. Clinical infections, the infection that you can see with your eyes, you can see the wound margins, maybe separating. You can see that excessive inflammation, perhaps some discharge, and perhaps you can just measure it with temperature of the animal. Those are things that you can almost hear, see, palpate. But subclinical infections are the ones that we are very concerned about because those are the ones that investigator says, everything's successful because my animals are all living. But what they don't realize is when they compromise aseptic technique, subclinical infections are a problem, which leads to data problems. So in this case, Dr. John Bradfield, he did this study where, again, please don't read everything. Let me explain. Where he inoculated his rats with high levels of staph aureus and pseudomonas. And even though none of these animals show overt, meaning clinical signs, subclinically, these animals are seriously affected in terms of they measured, he measured the fibrinogens, the glucose levels, white blood cell counts, and the histology scores are all messed up. So I hope you get a message that if poor rodent aseptic surgery results in delays and post-op normality, physiological changes, it affects the immune system, and it has an effect on data yield. So if you go to this website, and I'll show it at the end too, we have developed a number of videos and that you can videos and handouts, and some of them they need to be updated, but right here we have a lot of easy tips on aseptic technique, but I'm going to show you just a few. So I'm concerned about the typical lab where the student or the PI wears the nasty white coat, and here they have they're doing surgery and they have the sterile field, and that sleeve hangs over the sterile field. So to avoid that, at UTSA, University of Texas San Antonio, we require that investigators use these very inexpensive plastic sleeves, and they'll be disinfected with a high-level disinfectant. We use peroxigard at my institution. I know that peroxigard can't be found in most, probably other countries, but that's a high-level disinfectant with a claim of 1 minute sterilant. Yeah, maybe it depends on the disinfectant. You may not be eliminating every bug possible, but remember, the solution to pollution is dilution. So as we bring those levels down as much as possible to where the immune system is not overwhelmed, the immune system will do its job. We are concerned also with those investigators that have these little tiny sterile fields like this white sheet right here, and there's cross-contamination all the time, because as you can see, even the instrument right here on the bottom, the sterile gauze, and it's very easy to break sterility when we have a very limited sterile field. So we encourage our investigators to use extensive sterile fields, and I'll show you a video here that Sydney is going to play for us. Thank you, Sydney. And so I know some of you are wondering, wait, this looks like a grocery item. Please be patient. We're going to talk about that. We're just showing you a method and just a sample of the videos that we've created to really help you, investigator and veterinarians out there, to implement your aseptic technique. And so an example among many others, but be patient. In a few minutes, we'll be talking about this present seal. So the aseptic technique should continue even in the immediate post-op recovery period, because here's a rat had abdominal surgery, has fresh wounds, and we put him in this dirty cage, and that's not really good. And so this will be much better. Place your animals post-op into a brand new clean cage. So let me tell you what I consider the ideal rodent surgical draping. It should have the following five properties. One, it should be sterile. It makes sense. It should adhere to skin because you don't want the drape to move back and forth and contaminate the the wound. It should be impermeable because of the wicking effect that some people put cotton materials that are absorbent. There's wicking of contaminants, and then you can contaminate the surgical wound. And it should be transparent because most of us do surgery by ourselves, and we need to be able to monitor the animal, the color, respiration, character, and all that. And they should trap body heat because, as we will see in a few minutes, hypothermia is devastating to the surgical patient. And as a bonus, we like it to be cheap. So here's an example of a draping that many have used, and I have used in the past, and is it's not sticky. You have to put clamps on this poor little animal. It's difficult to visualize the animal, the respiration, and all that. So what we've done is that we have adopted the present seal, and believe it or not, it meets all the properties the of the sterile drape. But I know what you're wondering. So let me tell you a little bit of history. Maybe about 14 years ago, 15 years ago, someone told me about using present seal. I don't remember the context. So I told Lori at UT, I said, Lori, why don't we just test this? If you see that steak there or fruit, whatever it is, if present seal is contaminated, then that means that I don't think Glad, this company, will be in business today because of all the lawsuits. So it's got to be sterile. So I liked it because you can see through it, and it has a sticky side that sticks to the patient. And I like the fact that it was cheap. So we tested it multiple times, negative each time, good, clean, sterile uh, draping that we could use. I took the data to my IACO. I told them, hey guys, I want to start pushing present seal for our investigators. So they said, okay, you have the data. It's all about performance standards, and then I started talking about the present seal at meetings, and some people ridiculed me. Some people bought into it. Some people say I would never use a grocery item on my animals. Some institutions that the training program suggest, hey, why don't we start using present seal to increase compliance? And among our investigators, some veterinarians says absolutely not, and but let me but well, let me not get ahead of myself. Let me tell you, let me give you the evidence, even though a number of institutions, after I was presenting about present seal, started to adopt it after testing it in their programs. Eventually, ALAC considered standard of care. But I'll tell you a little bit more in a couple minutes on our publications on it, okay? Peer-reviewed publications. But let me tell you first about the solo surgeon. The solo surgeon is a problem with our rodent surgeries because the PIs, and I'm guilty of doing the same thing, is you assign someone to do everything. So this individual, uh, how does this person keep sterility? Let's say if you have to touch the anesthesia machine, the stereotaxic knobs, and all that. How do you maintain sterility if you have sterile gloves? You're the solo person. So the next slides will provide the practical solutions to this poor guy, the solo surgeon. Okay, so here I am. I have a rat under anesthesia, and I have sterile gloves, and all of a sudden this rat is going into respiratory arrest or having a hard time, and then I need to really lighten up the anesthesia because I'm overdosing it with isoflurane. Well, here you go. I just contaminated my sterile gloves. But what about if we use something like present seal or even aluminum foil, which we have tested? The Reynolds aluminum foil, we've tested it in the same story, and it's sterile, and it's a grocery item. How about if the stereotaxic apparatus? Those of you who do stereotaxic surgery, you know that you're constantly touching these knobs back and forth, 1 millimeter here, 1 millimeter there, and you just contaminated your sterile hands or gloves. There you go. Here you can keep from contaminating your gloves. You have to move your surgical lights, same solution. There you go. And what about the microscope? If you have to move the knobs of the microscope, easy solutions right here. And this is an interesting case of an institution that called me because they were having many surgical infections post-op. So I went there, spent a half a day going over techniques and presencia and all these things, how to improve aseptic technique. The next day, I came back and did an actual surgery, and then the postdoc had uh, had to use her iPhone to time her brain injections. And even though she didn't use press and seal, she used cling wrap or saran wrap. And I was okay with that because, although I've never tested cling wrap or saran wrap, I know that it's got to be sterile. But I don't like it as much because it doesn't have the sticky side. But nonetheless, she was using the timer. Look at how creative that was. And I took a picture of it. I loved it. And here she needed to write some notes. And here's what she did to protect herself from getting her gloves contaminated. So let's talk a little bit about this tip number 3 now. Okay, the temperature regulation. Okay. We know that I generally, I speak a little bit more in detail about this hypothermia issue because it is such an important topic to address because we know that anesthetics depress thermoregulation just right from the beginning. So once an animal's anesthetized within minutes, that temperature can drop severely, even during the induction period, because the thermoregulatory centers and vital centers, we know the blood pressure, heart rate, and respiratory rate, and all that are affected by anesthetics. On top of that, there is vasodilation, which the animal loses heat on top of having the thermoregulation down. And we know that the anesthetics prolong the recovery period. We all know that. We've done surgery. We know that warm animals recover faster. So we already have an animal that the respiratory centers are compromised. We let him get cold, and then we further lead this animal into hyperventilation. It affects platelet function. You wonder, and maybe some of us who have practiced in the past, I used to practice, and your regular clinical medicine in the vet clinic, and I wonder sometimes some of the deaths I may have had during the recovery period, or maybe even during surgery, may be attributed by the animals were not kept warm like they should have, because hypothermia leads to dysfunction of the platelets. It increases the risk of infection. It affects the heart, increases blood viscosity. So uh, there's you have more of a sludge, if you want to put it that way, of blood going through the alveoli, through those capillaries, and then the gas exchange CO2 O2 doesn't occur as readily. And of course, animals that are hypothermic will die more easily, and obviously data is affected. So good veterinary care involves the avoidance of hypothermia. I hope that at your institutions, you veterinarians, you IACUCs are really pushing for keeping animals warm or normal body temperature during surgery. If not, it's time to really start. We use press and seal to insulate the animals during surgery. This is an orthopedic procedure that we're conducting, and we're getting ready to wrap the leg now. We use actually press and seal to wrap the leg, but we have shown that the press and seal actually, because of the plastic properties, actually contribute to normothermia in the animals. So don't forget to include the tail, because we humans, when we go for a run on a hot day, we sweat. Horses sweat, dogs will pant, and rodents will vasodilate through the tail. So the tail should be included into the warming pad that you can see that bluish down there, and it should be kept as much as possible under the present seal. Okay, so here's an example. I know Kent invited me to speak, and I appreciate that. But I've been talking about this really for at least 12, 15 years, about the importance of these systems, like the anesthetics, the SomnoSuite, or even the SomnoFlow, uh, that is that Kent distributes, and these assistants that are really dedicated to rodents. Like a large animal anesthesia is better, the typical one that you see in vet clinics, the ones that we all use in some of our institutions, the large vaporizer is better in general than injectables, but nonetheless, those are made for large species, for humans and all that. Whereas these are precise. You put your weight of the animal, it gives you precise delivery. And then you have they have these systems. It's called the these infrared heating pads that uses a far infrared technology. So what it is that typically when you put an animal over a heating pad, you have that heating pad has to heat up quite a bit cutaneously, so that heat is transferred into all the organs. Well, the far infrared technology that can produces, you touch that pad. It's not that hot, but through the far infrared technology, it distributes the heat evenly throughout the body and also monitors the temperature. So if you set it at 38 degrees, 37 degrees, it will maintain it. It will turn on and off. So I there's an investment. I mean, these things cost, right? But it's really worth if you're going to be doing surgery over time, over years, and if you're going to monitor your animals, this is the way to go. So here we have a summary, and you'll have a copy of the handouts. I think they may have already been downloaded, and it's not going to go over this, but it just gives you a little bit of the summary of the properties of on the research that we've done in the publications in JLAS of present seal, in particular the sterility of present seal and the sterility of Reynolds wrap, and also the thermoregulatory properties of present seal. And so now, even though it's a grocery item, and I've been ridiculed, I'll take it with a grain of salt. I've been even teased at national meetings for talking about present seal. I'm fine with that. It was fun. But now we have the peer review data that shows you that these items can be used in a practical and a cheap manner. So hope you download this to your computers. And so let's talk about hydration. Okay. Well, hydration is also really important. It's one of those 6 tips that we want to just bring down. Remember, this is part of a bigger presentation. It's a 4-hour presentation, but these are the tips that I just promise you again that if you implement them all. 6 tips. That's all I'm asking for. 6 tips. And if you implement them, I can just promise you that your surgical outcomes will really improve and mortality will decrease. So we require a UTSA. And by the way, these things that we're talking about, they are not suggestions by IACUC. They are requirements of our IACUC, every one of them. I know that some institutions, and we'll talk a little bit about some of the other tips, they just provided my suggestions. My IACUC has made it mandatory. So Hydration pre-op is really important because the vital centers, they're affected by the anesthetics, including blood pressure. So we asked all our investigators to maintain cardio the circulatory volume as good as possible by asking them to, or by requiring that they give their animals pre-op fluids. And in general, we the dose is 10 to 20 mLs per kilogram, but we ask investigators to at least give for mice and rats a dose, a range, as you can see here. Surgical outcomes will improve if you give fluids. I remember a discussion or an email that interaction that I had with Paul Flecknell. So I'm sure many of you have heard of Paul Flecknell when it comes to lab animal anesthesia and pain management. I think the man is deity practically, and he implemented at some point in their program the pre-op fluids, and they saw, he had some data that showed that surgical outcomes greatly improved through the implementation of hydration pre-op. So let's talk about this tip number 5. We may be ending this talk a little earlier than so people can may ask questions. And oxygen supplementation. Okay, let me just put in perspective here. So if you, in the audience, you go under the knife, you're going to be in this in an OR, you're going to be monitored by an anesthesiologist, and the anesthesiologist is the head of the table, and fighting falling asleep because anesthesia literally puts me to sleep in more than one way. So anesthesia is one area of vet medicine that I just never. I remember the days in vet school when I had to do my anesthesia rotation, fighting falling asleep, and it wasn't the chemical; it was just how boring it seemed to me. But some people love it. But if you are the patient right there at the table, and your oxygen saturation starts dropping below 95, and all of a sudden your anesthesiologist starts opening his eyes and they keep dropping, they go into the 80s, and then he starts doing all kinds of things to reverse that because this individual knows that you're in a compromised situation. Yet when we use injectable anesthesia, and this is more of a message for those that use injectable anesthesia, because those most people that use isoflurane or sevoflurane and the rodents, they provide 100% oxygen to vaporize the anesthetic. But this is a message for those using injectable anesthesia. And there was a webinar that Kent Scientific sponsored. I don't know if it was last year, the year before last, where there was a significant discussion about this. But when you use these injectable anesthetics, let's say ketamine, salicine, the oxygen saturation quite frequently, of course, it's dose dependent, falls into the 80s and sometimes in the 70s. I don't think this is compatible with good physiology. It's hard for us, investigators, veterinarians, to really measure the damage that this hypoxia has caused to the various organs, and including even the brain. So people, do these head stages, and then they go do behavior tests, and you wonder, how good is that data after these animals have been hypoxic for a while. You heard of the baby, had the cord around the neck, and as the baby was being delivered, and then all of a sudden, there's some brain defects. And so I think the message here is that the lack of supplementation oxygen supplementation when using injectable anesthesia is not consistent. It's not good veterinary practice. And you may even consider malpractice. And that's how I convinced my IACOC is that, guys, we cannot suggest it. We have to require it. So we require oxygen supplementation at UTSA. So this is how we do it, okay? And you may use other methods. I'm just giving you some suggestions. We tell investigators that they can use. We have these anesthesia cards. We have vaporizers that our investigators can rent out, or they have their own vaporizers in their labs. And what we tell them is that you can turn on your oxygen, but leave the isoflurane off and mask them. I understand. There's some cases that you can justify not using the oxygen, or you cannot supplement with oxygen if you're doing an oral procedure. I don't know. So I'm sure there's some exceptions to these things, and our IACOC accepts justification for exceptions, but oxygen saturation is extremely important. And some institutions are using oxygen concentrators. We may purchase one soon, and even though they don't provide 100% oxygen, even at 50% oxygen, they're usually in the low 90s, but that's fine. But compare, so these animals that are being injected oxygen, they're breathing, at least at sea level, they're breathing 21% oxygen. 21% oxygen. But when you supplement them, you're really doing a lot of good for these animals. So let's talk about this. I'm not going to talk about pain control, pharmaceutical methods of pain control. I'm not, because I think we're all saturated. We know the doses. We know that we need to use analgesics in our surgeries. And so that's a given. But I'm going to focus on these non-pharmacological methods of pain control for a couple minutes. If you have a big headache, you have maybe a migraine, what do? You take your medicine, and then what do? You go lay down, you turn the lights out, you want the temperature to be right, you ask the wife, get the kids out of here, the dogs, I don't want to hear them barking. We just described a non-pharmacological method of pain control. So in a sense, we're treating the mind and other parts. So I'll let you focus on this slide for 10 seconds and then say thank you to biomedical research for the improvements in healthcare. So fear and anxiety enhance the pain response because providing a stress-free environment should be considered in the pain management program. In other words, we need to minimize stress post-op in order for pain to be part of, or in order to control pain in addition to the pharmaceuticals. But rarely do we see that in protocols, description of how animals are going to be stress-free. So let me give you a couple of examples. I'm going to give you an example here of right here in Dry. So that shredded paper there you see in the very middle. And by the way, minimizing environmental stress minimizes hyperalgesia. Hyperalgesia is the amplification of the pain response. In other words, if you put your hand over a stove, and typically you're gonna move it over a hot stove, and if the pain is typically a 6, well, now hyperalgesia means that pain level is at 8 or maybe 9. And so stress leads to hyperalgesia in our rodents. And so this is a case. I was a brand new veterinarian at Texas Tech, and I had 3 facilities in various parts of Texas. And I'll go do my visit in El Paso, Texas, and I go into my first do my rounds, and then I go into this room of rats full of that were individually housed, and they had an abdominal aortic device implanted and no wires coming out. So there was a plate, and those DSI plates that was measuring blood pressure. These were diabetic, obese rats. But all they had was the bedding, food, and water. That was it. barren environment. So I go talk to the investigators. Hey, Dr. Torrero, it's nice to meet you. I'm the new veterinarian. And I said, do you have any problems if we put EnviroDry, this right here in the middle, into your cages? He said, oh no, I never even thought of that. So okay, great. So time goes by, and then we uh, one day, months later, I run into Dr. Terreros. He chases me in the hallway. He says, Marcel, I need to talk to you. Ever since we implemented the EnviroDries, in other words, this enrichment for these rats to live in an environment, the environment that they like. These animals were already stressed because of surgery, and then because of they were individually housed, not socially housed. But you give them a little bit of this enrichment, and then he tells me, ever since we implemented the EnviroDry, the mean blood pressure has dropped 10 to 20 points. So his data had improved. These animals that were stressed, you know what the doctor tells you when you're stressed? Try to have some fun, try to relax and all that. These animals were stressed, and that's why their blood pressure was just so high, but it dropped under this enrichment. Let me give you just real quick. This is more about breeding than surgery, but it applies to surgery too. So we implemented, my institution, we put these red huts in all breeders. And because, the idea was just give them that extra enrichment in addition to the nestlets, and also maybe that rat, they couldn't see the monsters going by in front of their cages. And so time goes by, and I get an email from Dr. Suter, and Dr. Suter tells me, Marcel, thank you for implementing the red huts, because there was, before implementation of the red huts, my rats were producing 6 pups at birth. Now they're producing 12. So they went from 6 to 12 with some simple enrichment. Let me tell you about also at UTSA, we provide these diet gels, and 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 again, maybe I'm going to talk about cancers, but there's this institution that I work at there. Their animals lost weight because there were cancer studies, and the chemo or the cancer really makes you lose your appetite. So when they start losing about 30% of their body weight, automatically they had to be euthanized. But then we started implementing some of these supplements at the cage level. They were so tasty and so aromatic. I don't know what it is, but the mice started to eat it. And then when they started to notice the weight loss, instead of losing these animals to the humane endpoints, it could take them all the way up to the experimental endpoints and really keep the data. So supplementation and immediate post-op is really important. We do this at UTSA, and it really, really works. Social housing, please don't read all this, is what I'm going to present here. But the point is single housing is in many institutions the norm and the immediate post-op period, because investigators think that the mice are going to be picking on each other's wounds and all that. But so there's good evidence that, thanks to Van Loo et al., that when animals, social animals, are socially housed post-op, during the post-op period, morbidity and mortality decreases. So at UTSA, we require that animals are socially housed post-op unless they can justify it otherwise. So this is all what I'm talking about: the diets, supplementation, social housing, and all that, all part of the non-pharmaceutical method of pain control. Okay, so I wanted to let you know that we're working with Claire Hankinson and Ralph Malbrew and some colleagues from Europe. We're working on an overview of refinements in rodent surgical practices. Will be soon submitted to JLAS. Be looking for the article in JLAS, and we hope we can really help provide some more worldwide standards, and to again, the standards on good rodent surgical practices. So, as a last slide, here's a website that I told you I was going to show you. And again, this is our our training page was birthed out of a day that I was very frustrated at UTSA because I thought we had a pretty good surgical training program at UTSA, and then I saw that how the investigators were not getting it, and then one day I said, "Got this got to change." So I spent close to a year looking. I went to an institution in Wisconsin, and we started developing some videos, some handouts, and all that. And as a result, we've developed a page that we tend to we like, and some other institutions have adopted all of it or parts of elements of this training page for the institutions. And some people send me emails saying, "Hey, I need, can I use uh, your materials?" I said, of course you can. That's why here on the open web, they're not under a password. So you're welcome to any of this. And I have the video comes out of the one that you saw earlier. This is one of a penny. And I have several videos that show you how to open the present seal in an aseptic manner and all that. So that's the end of my presentation. And thank you for listening. I'm sure there are some questions that uh, you're ready to ask or you have already
Yes.
asked. And
Thanks, Marcel. Thank you so much. That presentation was incredible. Let's move on to our Q&A session. Marcel.
okay.
Okay. Our first question for today is, when you're using the press and seal with heating pads, is there any concern of animals overheating?
Well, definitely, because what you're doing, and we've actually seen that all of a sudden the temperature starts going up, but that's why uh, far infrared or technology, or in particular, anything that monitors the temperature of the pad is important. When you use those little disc hand warmers and all that, you really lose control of how much heat. And remember, hypothermia is an issue. Hyperthermia is also an issue. So yes, be careful with that, but you should always monitor the animal's temperature. Rectal temperature is the most commonly used method.
Thank you. Our next question is asking if there is much of a difference if you were to supplement with fluids before or after the surgical procedure, or is the point to give the replacement fluids in general? Doesn't matter.
So you can get fluids before or after. Uh, when you do it before the anesthetic episode, you are preventing that drop on blood pressure, which is it will lead to really drop of oxygenation in the brain. So we required pre-op. There's some cases, especially if you have a certain amount of blood loss, and maybe another uh, uh, injection post-op might be worth it too. But we always require a pre-op because what we're doing is we're preemptively addressing the issue of hypotension.
Okay. Thank you. Fantastic response. Our next question is asking whether you should press and seal or cling wrap all of your knobs, etc., once you have sterile gloves on. And should you change this for every animal?
So we have videos that shows you how to take it out. I'm not going to elaborate much on that because I gave you the link that you can just go and watch the videos how to use it. But yes, we if you're going to place it on surfaces, you need to wear surgical gloves, sterile gloves, and then if you need to do other duties after that, and where the gloves will be contaminated, well, you remove it and you put another set of gloves.
Okay, great. Um, our next question is, would you recommend fluids for surgery that lasts less than 15 or 20 minutes?
So it is not as important. The longer the anesthetic episode, the greater the need for fluids. So can I say 15 minutes is, we actually say at UTSA, just to well, we say that even for oxygen supplementation, if the anesthetic episode is going to last less than 15 minutes, we don't require, but we recommend it.
Okay.
Is that right or wrong? I'm not sure. But with fluids, and it's going to depend how much you're going to have some blood loss in those 15 minutes, and you're going to have to judge that yourself. But again, the greater the time, the anesthetic period, the greater need for oxygen supplementation.
Fantastic. Thank you.
Mhm.
Uh, we also have a question asking what temperature that you should warm the fluids to, ideally.
Room temperature. I'm sorry, animal temperature, which is about 37.5 or 38. I know that it is difficult to ask investigators to do everything exact. So we ask them that if you're going to be injected, at least someone can with the syringe kind of wet their wrist, and if it feels warm enough, at least that. But ideally, 37, 38 degrees. In fact, there's a paper out there that was published several years ago that if you keep the animal's temperature about 1 or 2 degrees above normal body temperature, that's favorable uh, for the animal.
Okay, thank you.
Hmm.
Um, really quick, I just wanted to jump in as we're approaching the end of the hour. If you do have to leave early, I just wanted to let you know that we will have a survey that will pop up at the end of the webinar. But if you could complete that before you go, that would be fantastic. So just a little pop up on your screen there. Let's continue. Um, do you recommend mixing isoflurane with pure O2 or room air, or is there not a difference? What would you recommend?
I know with the Ken Scientific vaporizers, the Sumner Suite, for example, you can use it with room air. However, remember that room air is 21% oxygen, and when you mix oxygen from the tank, that's 100% oxygen. So I know there's a paper published out there that indicates that there is little effect in the animal when there's 20 the vaporizer is mixed with room air 21%. However, there are other papers, and I have a hard time believing that's acceptable. However, other publications have shown that when you don't supplement, when you don't give the 100% oxygen, or I know in humans they don't use quite 100% oxygen, but it's favorable in terms of morbidity and mortality to mix it with the oxygen tank versus room air.
Okay, that was helpful. Thank you for
Mm.
sharing.
Sure.
Um, if you're using press and seal, how do you make sure it is sterile? I think we had a few questions come in on this. Do you use UV light? Do you autoclave it? How do you sterilize it before surgery?
So when I started using President CEO started speaking about different meanings, there was a company that started to sterilize it by ETO, ethylene oxide. And that's great if you want to do that. In fact, there's a couple companies started to do that to some, like Harlan, then it was called Harlan, now it's Innovative, I think. And, but we found it that over time, the many times we've tested it, including the ones that we have published, that it really comes sterile and it stays sterile for a period of time. And I encourage you to go look at the papers. We have tested it 6 months after locally. In the paper, I can't remember, I think it was, what is it, third in the JLAS paper, 30, 60 days, we could ensure sterility because of that's how far we did the testing with Ohio State. And so what we also encourage is the first foot of the present seal to discard. Let me refer you to our videos. So we show you really specifically, very easily, how you really need to remove that present seal. Again, we've tested it 6 months after it was open, and it stayed sterile after 6 months. Again, that's our local data, not a published data.
Okay, great. Are there autoclavable enrichment foods available? This person works in a germ-free facility and they haven't been able to find any.
Wow. I encourage you to go to Clear H2O, okay? And I don't know who this person is from. Maybe it's from a country where they have a hard time getting these supplements. And if you're here in the United States, BioSurf would be a good one to go talk to Clear H2O. And that's all I can tell you. And I know we buy our food, it's all sterile. Our supplements are all sterilized by radiation. Again, I talked to a lot of you guys out there in South America and sometimes like in Saudi Arabia and places like that. But especially in South America, where you have a hard time finding sterile supplements. I will tell you though that I know this institution that uses immunocompromised animals, and they use peanut butter from. Again, I'm not advocating, I'm not promoting this, but they use peanut butter as a supplement for their cancer animals.
Very interesting.
Peanut butter from the store, that's what I mean.
Oh, okay. um, okay, thank you so much. So our next question, do you use made-for-purpose face masks for rodent oxygen supplementation or other improvised items?
All of the above. There are so many rodent masks out there. You can intubate too. That's a tough technique. Ken Scientific has like these half masks that are really seal very well, and there's all kinds of masks. Yeah, sometimes you can improvise. Some people use syringes and they adapt them. They put a, a latex glove over the opening of the syringe, and then they poke a hole, and then they place the nose into the the latex or the nitrile glove, and so yeah, you can improvise. Uh-huh.
Okay, fantastic. Um, we have reached the hour, but I'm going to go a couple of minutes over. We do have a couple more questions that I would like to get to. But please continue to submit your questions. We will be passing them on to Marcel after the webinar is done. So yeah, keep sending them in. Is there a correlation with better outcomes and the type of anesthetic used, inhalant versus injection?
I'm sorry, would you repeat the question? I missed it for.
Sure. Is there a correlation with better outcomes and the type of anesthetic used, inhalant versus injection?
Oh yeah, most definitely. I mean, if you think about injectables, when if not all animals, even from the same stress, you give the same dose, even siblings from the same litter, you give that one dose, one will do fine, the other one may go into respiratory arrest or close to it. Okay, because once you inject it, you just, and the animal's going, you just get on your knees and you pray, please don't die, don't die. Okay, now with isoflurane or sevoflurane, you have a greater control over that dial. I definitely find it to be superior in many respects, in addition to the already mixing the oxygen with the gas, which is very favorable with the animal versus ketamine salicine, unless you're supplementing oxygen. So, and the recovery, remember ketamine salicine, for example, is metabolized through the liver in order to, and then it's urinated through the kidneys. And it takes a while for that to happen, both for induction and for recovery. When you use isoflurane, isoflurane is almost 100% inhaled and exhaled. So there's barely any metabolism through the liver when it comes to isoflurane. I know there's some human data that shows that sevoflurane, there's more of a 2 to 4% metabolism through the liver, but nonetheless, it's pretty much mostly inhaled and exhaled.
That was a great response. Thank you so much. I think we're going to call it there. We have gone a couple of minutes over. We appreciate everyone who was able to stay a little bit late. And I just want to thank you, Marcel, for such a wonderful presentation and
You're welcome.
really engaging Q&A session.
Good. Good.
I hope that you enjoyed yourself as well. In closing, we hope that you enjoyed this Inside Scientific webinar, produced in partnership with the Academy of Surgical Research and sponsored by Kent Scientific, and I hope you enjoy the rest of your day.